Thank you for joining us again. My name is Meryl Kalyani. I'm a Senior Program Manager with the Global Health Team at the NIHR Academy based in Leeds in the UK. I'm joined today by one of our co-chairs of the Global Advanced Fellowship Committee, Professor Kamija Phiri. Kamija, if you'd like to quickly introduce yourself.
Hi everybody. I'm Kamija Phiri, and I'm a professor in Malawi. I lead the training and research unit of excellence. Welcome.
Thank you. We also have a number of members of our global health team present here today who will be supporting throughout the session. We will also be playing a pre-recorded video from the NIHR Global Health Research Programme Director, Professor Kara Hanson, who unfortunately could not be here for the webinar. This is an overview of what we will be covering in the webinar. We'll start by playing a recording from Professor Hanson, giving you an overview of the NIHR Global Health Research portfolio and the new thematic priorities. I'll then provide an overview of the Global Advanced Fellowship Scheme specifically, covering key aspects such as eligibility, what you can apply for, and the application process. We'll then hear from our co-chair, Professor Kamija Phiri, about what makes a competitive application, and then this will be followed by a Q&A where you'll have an opportunity where we'll answer any questions that you've put in the Q&A.
My name is Kara Hanson. I'm the Programme Director for the NIHR's Global Health Research Programme, and I'm very pleased to be here today to share with you information about the Global Advanced Fellowships and the Global Research Professorships. Since NIHR was established in 2006, our mission has been to improve the health and wealth of the nation through research. And we deliver that mission through 6 core work streams, one of which is funding applied global health research and training to meet the needs of the poorest people in low and middle income countries. Across our research programs and partnerships, we've directly funded research in over 400 institutions worldwide and in more than 60 low and middle income countries. We've invested more than £700 million since we started funding in 2016. And we currently have 153 active research awards, 24 of which are directly contracted with low and middle income based institutions. NIHR has supported more than 1,000 individual researchers in low and middle income countries to progress their careers in global health. And we have currently 548 trainees. Our Global Health Research portfolio, which is funded through official development assistance, was established in 2016 and has grown significantly since then. Our current portfolio funds research through 4 different schemes. 2 of these are individual awards, the Global Research Professorships and the Global Advanced Fellowships. We also run an annual researcher-led call on a particular theme of interest. This is known as the Global Health Research Themed Program. In addition, we fund through partnerships with other research funders, leveraging budgets and expertise to address shared strategic priorities, to increase our research and impact, and to be in a position to act quickly in health crises. NIHR funds high-quality, policy-relevant, impactful applied global health research and training, and funds research that strengthens research capacity in both the UK and in low and middle income countries through mutual learning and knowledge exchange. Research should inform the development and testing of innovations, including clinical trials, support health systems to prevent and respond to health security threats, and provide insight into implementation in existing health systems in order to support deployment in real-life conditions and expanding to scale. Projects should involve community involvement and engagement and equitable research partnerships. By partnerships, we mean that relationships between Northern and Southern institutions should be fundamentally based and prioritize perspectives from the global health, be accessible to and involve stakeholders from both the global North and South that are committed to rebalancing power, and involve a fair distribution of resources, decision-making, and responsibility. NIHR expects project teams to involve community members in a meaningful way throughout the research process. We want to ensure that research is relevant to local needs, that the voices of marginalized people are heard, to build trust and increase the acceptability of interventions, and that these relationships should involve two-way communication and feedback. Research must demonstrate how it strengthens research capacity in low and middle income countries and in the UK. This can include supporting formal trainees, for example, through master's and PhD training. It can involve more experienced team members supporting early career researchers to take increasing levels of responsibility. It can involve sharing learning between collaborators, including from the global South to the global North. It should involve creating diverse research teams with a range of skills, for example, working across disciplines and working between academics and clinicians. And it should enhance organizations' ability to secure future research funding. These three elements, promoting equitable partnerships, community engagement and involvement, and strengthening research capacity, are fundamental pillars on which global health research funded by NIHR rests. I now want to talk a little bit about the thematic priorities in the current funding period. So our new thematic priority is to focus on global health security threats and challenges, and to support applied research that helps prevent, detect, and respond in the following areas. The first is vaccines, diagnostics, and therapeutics for infectious disease that have the potential to cause epidemics or pandemics. This includes applied research to evaluate interventions and social behavioral and implementation research to ensure that innovations are effectively adopted and scaled. We also are interested in research on pandemic preparedness, including research to inform policy and operational decisions, evaluate countermeasures, strengthen health systems and workforce resilience, and address social and behavioral dimensions. Our programs can support research on antimicrobial resistance, with a particular interest in interventions that can be demonstrated to reduce the burden of AMR, including later stage trials and social behavior and implementation research to scale innovative AMR interventions, applied clinical and systems research to reduce any unnecessary antimicrobial exposure, and to optimize antimicrobial use. We can also fund research on infectious diseases of poverty, and by these we mean diseases which disproportionately affect disadvantaged populations such as malaria, tuberculosis, HIV/AIDS, and certain neglected tropical diseases, particularly those of parasitic, vector-borne, or bacterial origin. Disadvantaged populations should include vulnerable groups such as pregnant women, newborn children, and adolescents. And finally, we can support research that looks at how best to break the cycle between malnutrition and infection. Within these areas, we welcome applications that include research seeking to improve maternal, newborn, child, and adolescent health. Our geographic focus is the poorest and most vulnerable ODA-eligible countries and populations in sub-Saharan Africa and South Asia. For these programs, what is out of scope is research that is basic or discovery, that is not applied, research that's primarily focused on non-communicable diseases. Climate change is relevant insofar as it shifts exposure, transmission, resistance patterns, or population vulnerability to health security threats. Malnutrition research is only fundable when it's directly linked to infection risk or outbreak vulnerability, specifically including mothers, newborns, and children. Standalone nutrition research will not be supported. And finally, we will not support research that is directly involved in implementing disease surveillance. We are interested in research that tests new ways to improve disease surveillance. With that, I'll hand you over to the next speaker.
Can I just remind everyone to please put any questions in the Q&A function instead of the chat so that they're visible to everyone and can be uploaded. Thank you. So moving on to the Global Advanced Fellowships Award specifically. The Global Advanced Fellowship Award sits within the NIHR Academy, where we develop and coordinate NIHR's academic training, career development, and research capacity development offer. We manage a range of national and global competitions for training and career development awards, aiming to attract, train, and support the people conducting leading-edge research and develop the skills of the next generation of health and care researchers to find life-saving solutions to key emerging health and care problems. Recognizing a gap in the global health funding landscape for mid-career researchers, particularly for those who are employed in low and middle income countries, we launched the Global Advanced Fellowship Scheme in 2024. The scheme aims to address this gap by creating a sustainable pathway to research leadership for global health researchers at the postdoctoral level. The award will provide funding and support for postdoctoral researchers to conduct applied global health research within our remit and to receive a bespoke training and development program relevant to their needs. Finally, we aim to strengthen research capacity in low and middle income countries through these awards. So who is the award for? This is a postdoctoral award. It is open to all postdoctoral levels, and you're eligible to apply for a Global Advanced Fellowship if you're someone who has recently been or about to be awarded a PhD, or someone with several years of postdoctoral experience right up to the point of being appointed professor or chair. It is also open to those who are transitioning into applied health or social care research from a basic research or non-health or care research background, or those seeking to reestablish a research career following a significant career break. Applications will be assessed individually, and you will be judged as an individual based on your experience and the opportunities that will have been available to you based on your professional background and circumstances. So what does the award fund? The award uses ODA funding to support research and strengthen research capacity to help protect, detect, and respond to global health security threats and challenges. You can apply for a 2 to 5 year award of up to £750,000, which will fund your salary as the lead applicant between 50 to 100% FTE, and an applied global health research project in line with our remit. One thing to note here is that for the Global Advanced Fellowship, early translational research is not within remit, and any research involving biomarker research that aims only to elucidate mechanisms underpinning diseases or identify risk factors for diseases is out of remit. So search for biomarkers is out of remit. Through the award, you can also fund a research support post, such as an RA, a PhD student, or postdoc, travel for fieldwork, collaboration, and training, research capacity strengthening, and this would be focused on in the low and middle income country within your award, community engagement and involvement, knowledge mobilization and research uptake, and research inclusion. I'll now cover the eligibility for the award at the individual institutional and ODA level. Firstly, at the individual level, the scheme is open to all health, public health, and social care research and methodology professions. You must hold a relevant PhD or postgraduate medical research degree or have submitted your thesis for examination at the time of application. And you must have been awarded your PhD or postgraduate medical research degree by the time you attend interview. You should not already hold a professorship or chair at the time of application. You must also be employed by a higher education institution or research institute in ODA-eligible low and middle income countries in sub-Saharan Africa or South Asia, or in the UK. At the institutional level, the contracting organization will be your employing organization and can either be a low and middle income country higher education institution or research institution in sub-Saharan Africa or South Asia. The list of eligible countries is linked through in our guidance. The institution must have a track record of research funding. Alternatively, your contracting organization can also be a UK HEI or research institution. The contracting organization will have overall responsibility for the management of the award and should be able to manage the setup, running, and reporting of a research project. They must also be able to provide you the appropriate academic support throughout the length of the fellowship. There is no limit to the number of applications that can be submitted per institution. However, we do not expect to fund more than 2 awards per contracting institution per round. If your contracting organization is in the UK, then you must have at least 1 partner organization in a low and middle income country in sub-Saharan Africa or South Asia, where you plan to conduct your research. And that main partner organization must be an HEI or research institution. If your contracting organization is in an LMIC, then you may wish to include other organizations to foster South-South collaboration, but this is not a requirement. In terms of ODA eligibility, projects must benefit people living in 1 or more ODA-eligible countries within sub-Saharan Africa or South Asia. And within applications, you should clearly outline which countries will directly benefit and how your application is relevant to the development challenges of this country or countries, and how the outcomes will promote health and welfare of people within those countries. Moving on to the application process. For this round, applications have opened on the 14th of April and they will close on the 30th of June at 1 p.m. Interviews will take place for shortlisted candidates in January 2027, and award start dates are expected between April and October 2027. This year, applications will need to be submitted through our new NIHR Awards Management System, which you will find linked on the funding opportunity page of our website. And then in terms of the assessment process, the application window will be open between April and June. And applications will then proceed to a funding committee review and then be shortlisted. Those who proceed past shortlisting will undergo a peer review process and then be invited to interview. The committee will then submit the recommendations to the Department of Health and Social Care, and outcomes will be confirmed with applicants, with awards starting between April and October 2027. So what are some of the key elements of the application? As mentioned, the application process this year will be through a new system. The application form also looks different from the previous round, and there are a number of new elements to highlight here. One is that you will be required to upload a narrative CV to the application, and there'll be a template provided in the application form that you need to fill out. This will include your research outputs, overview of your career to date, including your contributions and achievements. You'll be able to include any contextual factors for the committee to consider. And the application will also link through to your ORCID profile, and this will be used by reviewers as the source for your publication record. So you must ensure that this is up to date and that you include any key research outputs that you want reviewers to be aware of. In terms of your award plans, you'll need to include a detailed research plan and a career development program. The templates you're required to use are linked in the application form itself. You will also need to provide an overview of your community engagement and involvement plans and research inclusion, which is a new condition of funding within all Global Health Research Awards from 2026. You'll need to include your support team, which includes mentors who will provide research and career development guidance. You'll need to include between 1 and 4 mentors, and at least 50% should be from LMIC institutions. Mentors may be based in your contracting or partner organization or elsewhere. If you're requesting salaried practice time within the award, you should also include details of 1 or more individuals who will provide professional practice support. And these should be designated as practice supervisors to differentiate them from any academic mentors. You will also need to include your head of department from the contracting organization where the award will be based, and from the partner organization if this is required. And you will need to upload a letter of support from your contracting organization and, if applicable, your main partner organization. Your application must also include an element of research capacity strengthening. However, a key change here is that this round, the focus really is on individual capacity strengthening, recognizing the career stage at which this fellowship is focused on. This element must be within the LMIC institution you are working with, either the contracting organization or the LMIC partner organization. And you're able to use up to 5% of the award budget for this. Activities should be developed in partnership with the LMIC institution in your application, and it can include a range of things: training and technical research skills, or training and support to facilitate effective community engagement and involvement. With that, I will pass it on to Professor Phiri to talk about what makes a competitive fellowship application. Over to you, Kamija.
Thanks very much, Miro. Next slide, please. Next slide, please. All right, thanks for that. And so just to take over, I think if you can go back one slide. Thank you. So just to say that, there are 2 subcommittees that will be reviewing and assessing your applications, the early and the senior career subcommittees. And these assess your applications in a very transparent and unbiased way. Next slide, please. So we are really looking for very strong applications. And over the time, we have realized that, there's some features or characteristics of strong applications. One thing that we've noticed is that they usually will have a very distinctive idea, and they will be self-driven, and they will really show that there's really a direction of growth. We usually would say that this person has a really good career projectile, is a rising star. So I think that's the sort of person that you should be trying to frame yourself in when you're writing these applications. We want from the application to know why you need this application, this fellowship at this point in your career. So we're interested to know what will this application do to you, or how will it help your career move forward? How will it help you build your research team, for example, or your partnerships? We also want to know, and we want you to demonstrate how and why you're interested in working in a specific discipline. And I think in your application, you should clearly, build up the need or justify the need to do research in this area. So that's the unmet need, and would like to really see that well articulated in your application. Next slide, please. So I wanted to talk a little bit about what I believe is the architecture of a good research idea. And this may apply to various other proposals and that you may make. So I think there's about 5 important elements. They may be even more, you might add more, but I think the first one is around innovation. So a research idea should be really bold, but it should have a bit of, a good balance between taking a risk and also having a safety net. I would encourage you to consult very extensively. Believe in yourself, believe in in your idea. The other bit is around the science. There should be a good biological plausibility around the hypothesis, around the postulations that you are proposing in your proposal. The study design, I cannot overemphasize, should be airtight. We have seen, you should be able to select the right design for your research question and be able to think through why that is the right design. Think about also, if you have done previous work in this area, quote it, make reference to it and show that, you are already interested in building a research career in this area. If you haven't, that's all well and good. Make sure you have a good grasp of the literature, of the scientific evidence that's around this area that you're interested in. The next element is feasibility. Think about the operational capacity. Where do you want to do your research? Which partner, which country, which institution? Is the capacity there for you to actually do your research? Is the infrastructure there? If you're going to be collecting data from participants, are you able to access them? Are you going to be able to recruit them in time within the time limits that you have actually proposed? I always encourage my students to also do a dry run in their head. So to think through and imagine you are sitting, if it is a hospital-based study, you're sitting in the patient's waiting room where you'll be recruiting your participants from. You then go through in your head, getting consent, getting data, taking the lab sample to the lab or collecting it, and even thinking, what container will I actually carry that sample in? If you're doing a focus group discussion, think about where you're going to get your participants, where they're going to sit. It just helps you run through and test the feasibility of your research idea. Think about your sample size. I cannot overemphasize the sample size that you put in your proposal, the way you calculate it, the amount of details that you put in the proposal should be enough for a statistician or somebody else to reproduce that sample size. If it's a conceptual theory, make sure it's airtight. Think about your collaborations. That's the other element. Think about if it's a multidisciplinary study, think about who are the right people, the experts, the people who will really truly add value to your research idea or to the implementation of your research. Lastly, impact. And this is the so what question. You do your research, so what? There must be something that it's leading to or it's adding value to. So think again about that as you're thinking and constructing your research idea. Next slide, please. Then quickly going on to your research plan. Make sure that it's within the remit of the fellowship. I think it's clearly stated, Miro has clearly stated the remits. Go back to the website, read them, make sure it's within those remits. Think very carefully about, how much your work is adding to the existing evidence, scientific evidence base. Also, make sure that your work is directly or primarily relevant to the LMICs in sub-Saharan Africa or South Asia. When you're thinking about preparing your budget and providing, costing your activities, make sure that it's a good value for money. Make sure that the scope of your research and your budget request, they actually tally. Make sure also that you have a good community engagement and involvement plan. I think this is something that in the past we have seen that some applications, they just gloss over it. It's a very important component, and it is actually it's scored and contributes to your final mark. Think about your collaborators and again, how they're adding value during all the phases of your research. Next slide, please. I think Miro has covered this slide quite a bit. So this is around training and development. At an individual level, I think you should, self-critique yourself. Think through your skills. What skills do you want to build? What skills do you need in order to implement your research proposal? And then also think of what skills you need in your career, future career, even after you finish this fellowship. I would like to believe that most of us want to be a research leader. So think about what skills you need to get to that point in your career. Think about your team and where you're doing your research, and think about how you can also support them. Next slide, please. So the contracting institution support is also very important. We have seen a lot of letters that are written by the contracting institution that are sometimes very generic. These letters should be tailored to the individual. They should be, talking and trying to support that person as an individual. We want to be able to have an appreciation of the short, midterm, and also long-term support that that institution is willing to make. It also must just talk a little bit about the partnerships around which that will support you in developing your career and conducting your research. Lastly, the organization should also make a statement around creating and maintaining an inclusive and supportive research culture, and also should have a track record of research funding. Next slide, please. When you're developing the application, a few hints. Strongly advise you to get advice and support from a lot of people. So it's good to talk to your peers, talk to your seniors about a research idea that you have. I always think of a research idea as a rough diamond. And the more people you speak to, it gets polished from different sides. And in the end, becomes a proper diamond. So talk to people, don't shy away and listen. Some might support, may give advice that you may take on board, some you might not. The next point is be very, very familiar with the literature around the subject area, around the problem area that you want to work on. It is very disheartening when a reviewer notices that an important or pivotal scientific evidence, maybe a very important study that was done in this area, is not made any reference to and was really supposed to. So please be familiar with your subject area. Think critically about your aims and your objectives. I must say it's something that I always start with when I'm even sometimes reading a proposal, to just quickly sass out to see what is the main research question. So it's a very important starting point, and this will define how ambitious and exciting a project is, but it should be a really good balance with it being realistic and achievable and feasible. So that's the sweet spot. So make sure you're striking that spot. Read the guidance very carefully. Those footnotes, in each section that you'll need to input information, there's always instructions. Read those very carefully and think through them before you respond. Share your draft with your colleagues. So it's really nice when you write a proposal, you're so engrossed in it, you are you've been thinking about it the whole time. It's good to give it to a senior person or somebody else to just look at it with another lens, and they'll be able to sometimes identify some big areas that you thought you had covered well, or you had explained well, but actually you hadn't. And this just helps polish your application. And lastly, I would not overemphasize that you should give yourself enough time. So don't leave it to the last minute. Start right away. Next slide, please. So some common pitfalls that we observe is one, applications that don't meet the remit. Some applications are just not clear. The details are just not very clear. So it might be the research questions, it might be the study design. There's just not enough detail in these sections. Some proposals are just overambitious and they are not suited for this award. Sometimes the supporting commitment from the partner organization or the contracting organization is very generic and is poorly articulates how they're going to support the candidate. In other instances, the training program is not well structured and is, again, very generic. Make sure you also articulate the ODA, the countries in which you're going to do your research, or countries in which you're going to do the research, and how it will benefit or meet those countries' development challenges. The value for money, think carefully about your budget, the resources that you're requesting. But again, this is an area where we find that there's no value for money. And lastly, the CEI. It's usually, some applications, it's weak, it's not well embedded in the proposal. So just make sure you're articulating this very well, you're thinking through this very well. So I think that was the last slide, and I think we'll be going into a Q&A session.
Thank you so much, Kamija, for that detailed presentation. So yeah, we will move on to the Q&A portion of the session. I am going to answer the questions that are in the Q&A that have been upvoted to start. A number of questions have already been answered in the Q&A function, so do have a look at that in case your query has been addressed there. And as always, if we are not able to get to your question, please email us at ghrtp@nihr.ac.uk. The email address is on the screen. So the first question is if you're allowed to have 2 support posts at 50% FTE, and whether the award allows for project administration costs as separate costs to support staff. So as part of the award, you can include a support post. This is usually limited to the equivalent of 1 full-time individual. If you wanted to split that into 2 support posts both at 50% FTE, that would be allowed. In terms of project administration costs, in addition to the support post, you can also budget for shared staff costs. So these are costs for an institution that would typically be kind of shared resources between different projects. So for example, field staff, and you can include these, but we would limit this to 30% of any individual's time across the award period. We have another question around if you're applying from the UK, if there is a ceiling for the share of funding that should go to the LMIC partner. So there is no predefined requirement or guidance around this, but we would expect that the majority of the research is taking place in the LMIC country, and that the share of resources is equitable. Kamija, I don't know if you had anything to add here from a committee perspective.
No, I think what you have just said is quite covers it. I think we really want to see an equitable share of the resources for in such a case. Yes.
Thank you. There's another question around research collaborators and whether there's room to fund collaborator meetings and travel. So if you are applying from a UK institution, you will have to name an LMIC partner / collaborator in your award, in your application. So there is space in the application to do that, and they will be also required to submit a letter of support for you detailing how you'll work together. And you can, of course, include, if there are elements of the research that they'll be supporting you to carry out, you can include the associated research and travel costs. Collaborators are different from mentors. So mentors are not allowed to claim for costs within the award, but you as the lead applicant can ask for travel funding to, for example, meet with your mentors. There's another question around whether you're eligible to apply if you have submitted a related fellowship application to other funders, such as the UKMRC or Wellcome Trust, and this is still under review. Yes, so the application has a section where you will be able to indicate if the application has been submitted elsewhere and what the outcome of that is. So if it's under review, you can mention that. If it was unsuccessful, then you can mention that as well. If it was unsuccessful and you're submitting the same or similar application to us, then you will have to indicate how you have taken on board the feedback you received to improve the application. It is worth mentioning, I think, also that if we would not expect successful awardees to hold more than one personal fellowship, but it would be fine if you had, a different kind of a research grant in addition to the fellowship. There's a question around whether we expect the funded support post to be located in LMICs. Yes, that we would. It is not a requirement, but we highly recommend that you consider that. There's a question around looking at ways to prevent HPV infections among vulnerable populations is in scope for the GAF call. So as I mentioned, there are 5 key focus areas within this kind of thematic priority of global health security threats and challenges. And then one of those within that is around infectious diseases of poverty. So if you feel that your study focus fits within those 5 kind of criteria, the first being vaccine, diagnostics, and therapeutics. The second is pandemic preparedness. Third is AMR. Fourth is infectious diseases of poverty, and then breaking the cycle between malnutrition and infection. Then that would be considered in scope for the GAF call. If you'd like to further explore what the eligibility, you can always email us a short description of your proposed research, and we'll be able to give a more definitive answer. There's a question around how we are defining neglected tropical diseases that would be within scope. So the way I would, I guess, answer this is that we would be focusing on infectious diseases or NTDs that disproportionately affect disadvantaged populations. So you can kind of take that as a bit of guidance around whether your proposed research would fit. And again, if you have more specific questions, you can reach out to us by email. Haley, I'm not sure if you wanted to add anything there with regards to NTDs.
Yeah, thanks, Meryl. I think we have said, particularly those NTDs that focus on like parasitic, vector-borne, and bacterial would be the main ones we are looking at being in scope at this time.
Yeah, thank you. There's a question around thematic priorities. So no, unfortunately, we would only consider proposals that fit within the 5 thematic priorities.
Can I just add, Meryl, to that?
Yes.
A few people have asked how long those thematic priorities are going to last for. So those priorities are the 2026 to 2030 strategy. So they will be set for that time period. So yeah, that's how long we will be focusing on these areas. I think quite a few people had asked about that. Thank you.
Thanks, Mariel. There is a question around whether the call is meant for those with medical degrees only, and if mentors have to be affiliated to academic institutions. So to answer the first, no, the call is open beyond to those who don't have a medical degree. It's open to researchers across the spectrum. Your mentors do not have to be affiliated to academic institutions. We do recommend that you kind of clarify in the application how you've selected your mentors and what they bring to the award, and how their support will be instrumental for you. There's a question around a PhD post, and whether they should be registered in the LMIC institution or if they can be registered in the UK HEI. Haley, did you want to answer that? Or are you happy for that?
No, I can do. I think, yeah, we don't have a strict rule around like where the PhD student should be based. I think the main thing to check within, we do specify this within the guidance, but that if you have PhDs based in the UK, that we would expect them to be from a low middle income country, the person to be from a low middle income country, and we would expect there to be an agreement with the institution around the fees, that they wouldn't have to pay overseas fees for this. But the PhD itself can be registered within whichever institution makes the most sense in terms of the post and the capacity strengthening.
Thank you. There's a question around if you are employed in the UK and willing to return to an LMIC, if you can apply from an LMIC institution. From an LMIC visiting affiliation. So the institution that you apply through, which is your contracting institution, should be where you are substantively employed for the duration of the fellowship. So you don't have to be employed currently at that institution, but you can apply through them. They will be required to obviously submit a letter of support, but they should be your substantive employer for that duration. In terms of commitment to support from the contracting institution, there is detailed guidance around this in the application form guidance that's linked on the funding opportunity page for this award, which details what are the kinds of things that we're looking for here. Kamija, is there anything you'd like to point out in terms of a strong letter of support that the committee looks for from the contracting institution?
Yeah, I think what is really important is that the contracting institution should really be talking about you as an individual, and clearly articulating how they will support you for this research grant, but also trying to think about how they will support you in the mid and also long term. So it should articulate, their commitment to you, but it should also articulate, how the institution itself, what capacity it has to support your research program. Talking about the partnerships that they will bring on board to ensure that you are you have a successful research grant. I think those are the sort of main things that you would want to see come across in a letter. Thank you.
Thank you. There is a question around the number of GAF to be funded. So in this round, we expect to fund 10 awards. There's a question around LMIC partner organization eligibility and whether the partner can be a public entity such as a national health or education service. So your main LMIC partner organization must be an HEI, a higher education institution or research institute. You can also have other LMIC or other partner organizations who can be HEIs, research institutions, or charity or non-governmental organizations. And you can find these details in the eligibility section of the guidance. Can you have mentors from non-UK high-income countries? Yes, you can. We expect that at least 50% of mentors listed are from LMIC institutions, but you can have mentors from non-UK high-income countries. Yeah, and you know, just make sure you kind of justify how you've kind of picked your support team and what they bring to your development. In terms of number of applications, answer that question. I see a number of questions around the remit, and I would recommend if you can, it would be difficult for us to answer those specifically in the time we have left, but I recommend if you can just reach out to us by email and we'll address your queries. So I think that's all that we have time for today. Thank you so much for being here and for your interest in this award. And thank you also to Professor Phiri for attending and sharing his views and thoughts. We look forward to receiving applications, and if you do intend to apply, all the very best. And as I mentioned, please don't hesitate to reach out to us, and we'll try and assist as best as we can. Thank you very much.